Hello to everyone, and thank you for your question. Well, the field of exercise oncology, and in particular, understanding if exercise could help patients with cancer, has always fascinated me since my university studies. I started to study the effect of exercise in oncology in 2016, first with my master thesis and exploring the relationship between physical activity and quality of life in oncological patients, and then with my PhD, which was totally focused on investigating the psychophysical impact of physical exercise on oncological population. And now that I'm a postdoctoral researcher, I continue to deal with this topic because over the years, I found that this approach may be very beneficial for patients. And I want to tell you a very particular anecdote, because the first patient that I followed with a physical exercise program was a young woman affected by an advanced pancreatic cancer. And I remember that initially the patient was very physically deconditioned. For example, she was able to perform only 10 minutes on a cycle ergometer and only 3 resistance exercise at light intensity. However, session by session, she rapidly improved, edge strength, for example, gained, and after 12 weeks, she was able to complete 25 minutes of cycling and more than 6 resistance exercises at moderate intensity. After this first experience, I had the opportunity to exercise several other patients in both clinical practice, but also within a clinical trial. And from my own experience, and also from the current literature, we know that physical exercise may help patients with pancreatic cancer from several points of view. For instance, from the physical perspective, patients may experience significant improvements in pulmonary function and in the cardiovascular system that can be translated in a better cardiorespiratory fitness. In addition, it is well recognized that that physical exercise may increase the strength level and may improve body composition in patients, especially by stimulating the muscle gain. And this enhancement may help patients to better tolerate the anti-cancer treatment. Indeed, we know that compared to insufficiently active patients, those who perform physical exercise usually have fewer treatment-related side effects and may experience improvement in different symptoms. However, we know that the impact does not finish here, because exercise may also have a positive effect on the brain. Indeed, physical activity is a potent modulator also from a psychological point of view, enhancing patient mood through a reduction in anxiety, distress, and depression level. Well, in summary, exercise is a potent and useful strategy that patients with pancreatic cancer may adopt to improve physical and psychological features and enhance their quality of life. Well, from the preliminary data of our research group, we know that unfortunately, only 11% of patients with pancreatic cancer are sufficiently active. And for this reason, to effectively promote physical activity among this population, a team effort is mandatory. In this sense, healthcare providers may have an essential role and should be first and proactive in physical activity promotion in clinical practice. Several organizations suggest that the communication between patient and clinician is fundamental to facilitating the implementation of exercise. A simple approach that healthcare providers may introduce could be composed of 3 steps. The first could be the assessment, identifying an active patient using appropriate screening tools, such as dedicated questionnaires that are usually easy and quick to administrate. The second may be the advice. In this light, healthcare providers should strengthen the importance of exercise during the anti-cancer treatment, highlighting the physical benefit as well as the potential improvements in terms of treatment-related side effects, for example, and quality of life. And the last should be composed of referring insufficiently active patient to an appropriate exercise service. Indeed, ideally, each patient who is insufficiently active should receive a tailored exercise intervention addressed to improve his or her outcomes. However, unfortunately, we know that the dedicated services are still few compared to the real need. So, in the case the referral is missing, other solutions could be considered. For example, care providers could deliver a more structured advice, but we know that the verbal recommendation alone may be insufficient to increase exercise level because it may be easily forgotten. But to overcome this obstacle, healthcare providers could hand patients other tools such as printed materials, specific guidebooks, or video support that may be optimal strategy to support patients in becoming active.
Everybody, thank you for these kind words in advance. I'm really happy to be part of this pancreatic physical activity panel today. And I did not have pancreatic cancer. I just had breast cancer. So I recognized this disease after my expedition in Papua New Guinea. I was climbing one of the 7 summits, the 7 highest mountains on the 7 continents. And I was really charged with a lot of energy by always being physically active. And as you know, as medical doctors and sports scientists, that someone who has been in a very high level is even more physical fit than when we are doing training in our normal environment. So when it came to my cancer diagnosis, I was like, I was not really shocked because I already felt, because I know my body very well, I already felt that there is something wrong. During the day, during the expedition, I was super fit, but 6 o'clock in the evening I slept while other people were eating and filling their bodies with nutritional food fuel. I was sleeping, but I had enough energy to continue this expedition till the very end. As I already said, I felt that there was something wrong. When I arrived in Germany, I visited my gynecologist and he said, okay, Petra, you have 5 malignant tumors in your right breast. So this was the bad news. The good news was that I was physically very fit, and as long as I can think, I was also a mentally strong person. So for me, it was okay. You have cancer. It's like a challenge climbing a high mountain. So I did not accept, as other people were telling me, oh, the cancer is your enemy. I accepted cancer as my friend, because friends bring you to a good result in your life. If you have a really close and good friends, then everything is much easier. So this was my philosophy from the very first moment on. And I had also a really great start into my cancer journey, because a friend of mine, he is a director of a university hospital in Hamburg. And I called him and he said, okay, come on, you can do your sports thing and just continue what you always have done in your life. From the very beginning, as you already mentioned, Luisa, I was fascinated by nutrition. I was, I think, one of the early, one of the beginners in plant-based nutrition, while my parents told me, we cannot eat this vegetarian stuff. I did it. For me, it was the right decision, for others not. But especially when it comes to pancreatic cancer and malnutrition, perhaps this is not the right way. But I'm not a pancreatic cancer nutritionist. I'm not very experienced in that. But in a way, I recognized that all the things I have done my whole life long paid off for this cancer journey. So I was always, no, quite always physical fit. I had a really great environment. My children, they were grown up already, 18 and 19. They went running with me or for a walk, and I tried to do all my daily work. I tried to continue to my daily work. So for me, it was not that difficult, and I recognized when I'm talking with cancer patients, and when they were already physically active before the therapy, even there are studies, you should start during therapy, they had an easier journey through their cancer disease. Then a lot of have changed. This was in 2015 where I've got my diagnosis. In 2016, the European Commission already launched the first panel. It was called The Fight Against Cancer is a Team Sport, the Role of Education and Sports, and they invited me to Brussels. Since then, some years ago, in 2021, the Europe Speeding Cancer Plan appeared on the European ceiling. And right now I have written with my team 2 project proposals in the framework of EU for Health. One is in primary prevention for schools, in primary and secondary schools in 6 European countries. And the other one is Outdoor Against Cancer Connects Us, a project which cares for a healthy lifestyle based on the 4 OAC pillars for young cancer survivors. So to shorten that up, a lot have changed since my own cancer journey. The only thing what not have changed as much as it could have changed are the offers for the cancer patients. So we know a lot about the influence, as you already mentioned before, the influence of physical activity, nutrition on the cancer journey, but we don't, most of the time we don't have offers for the patients in parallel to their therapy to keep them on track and to give them parallel recommendations and guidelines and offers for their healthy future.
Everyone, can you hear me? Yeah.
Yes.
Yeah, thank you for the invitation for this important webinar. And I'm glad to be here and share my experiences. I think when it comes to pancreatic cancer, it's very important to realize, there are 3 different types of pancreatic cancer. As Cindy was saying earlier, the inoperable metastatic pancreatic cancer, the resectable pancreatic cancer patients, which we see most often as a surgeon, that's the patients I see the most. And the people who are in between, the locally advanced or borderline resectable pancreatic cancer patients. It was quite pleasing to see the APACAP trial data, which Cindy was presenting earlier, to see even in the inoperable metastatic pancreatic cancer patients, where when we offer them a form of prehabilitation program while they're having the palliative chemotherapy, to improve their quality of life. Because at this point of time, certainly to my knowledge in the UK, we do not have a program in place for patients with inoperable pancreatic cancer. Often the priority for these patients when they come to see me in the clinic is to improve their quality of life and get them access to palliative chemotherapy so we can prolong their life. But the group of patients we try and focus the most on are the resectable and the locally advanced and borderline resectable. The resectable group are quite unique in the sense we only have 3 to 4 weeks to work on these patients from the time they present with their diagnosis of pancreatic cancer and by the time they get their Whipple operation or a distal pancreatectomy. So they still have that 3 to 4 week window to work on. And at the Freeman Hospital, we get them all to be seen by the enhanced recovery nurse, the ERAS nurse, who gives them an exercise sheet and gives them an exercise regimen very similar to what Cindy was proposing earlier, a combination of aerobic exercises and muscle strengthening exercises. We often advise them to do 120 minutes of aerobic and muscle strengthening exercises a week, if possible. But I have to remember these are unsupervised. We give them a leaflet and expect them to undertake these exercises. These are unsupervised. Ideally, a supervised exercise program might have better outcome than an unsupervised exercise program. That's the advice we give them to you, and that's part of the pre-rehabilitation program. It's also important to remember there is also a rehabilitation aspect to pancreatic cancer treatment, which is the treatment they're going to get from a exercise point of view and nutrition point of view after surgery. And we also have a rehabilitation program in place where they get seen by the ERAS nurse again at discharge and give them exercise advice after discharge. The other interesting group at the moment is the local advanced and borderline resectable group of patients. The benefit in a way for these patients is they have much more longer time frame to have the exercise intervention before their surgery, because they get 3 to 4 months of chemotherapy, and they have a bit more time to have the exercise interventions, not just exercise interventions, but also nutritional interventions. And what we try and adopt is a trimodal approach where you have access to exercise interventions, nutritional interventions, for them to see the dietitian, to make sure, as simple as for them to be on Creon, and most importantly, some form of psychological support. That's not available in the position, psychological support, but ideally a good form of rehabilitation program should involve all these components: exercise program, a nutritional program, as well as psychological support. But that's something we should aim for, and that's something we should work towards for the next few years, not just in the UK, but also in Europe, to improve both the short-term and long-term outcomes of these patients.
Yes, sir.
Yeah, that's a very important question, because often these patients are deconditioned, they're sarcopenic, malnourished. So having some form of physical fitness is important to get them to surgery. And unlike other forms of cancer surgery, pancreatic surgery is quite complex. The risk of complications is much higher. Morbidity is higher, and there is a small risk of mortality with pancreatic cancer surgery. So it's very important these patients are physically active and physically able enough to be able to undergo pancreatic resection. And one of the things we always do before they get to Whipple operation is something called cardiopulmonary exercise testing. It is a form of exercise testing where we ask patients to go and sit on a bike to see what their fitness levels are, and that gives us an idea of what their aerobic and anaerobic fitness is. And the patients who have high levels of anaerobic threshold, they tend to do much better when they have major surgery in terms of postoperative complications. Anybody with an anaerobic threshold of 10 or 12 or above generally tend to have much lower complications. And we published this data a few years ago, not just lower complications, less risk of leak from the pancreas. So even that 3 to 4 week window where you have an opportunity to exercise a little bit and improve your physical fitness may have a significant impact on their recovery from major pancreatic surgery like Whipple operation and the complications of the Whipple operation. And this has been published many times from various centers. The other benefit of that physical exercise and activity before surgery is not only reducing the complications, but also for them to be able to get to chemotherapy after surgery. Much higher fitness levels means quicker recovery, and that means getting access to chemotherapy. And we know for pancreatic cancer, surgery on its own is not going to improve survival. You need to have surgery followed by chemotherapy. And the patients who get to chemotherapy are those who are physically active, not just to get to surgery, but physically active enough to get to chemotherapy as well. And that just not only improves the short-term outcomes, but can only improve their long-term outcomes and improve their long-term survival. So that's what we should be aiming for, is to have a form of a treatment where it encompasses prehabilitation, surgery, followed by rehabilitation after surgery, to get them access to chemotherapy and prolong their survival.
Thank you, Luisa. Thank you for having me speak today. Well, I mean, how different it is now versus when I was diagnosed in 2007. These conversations were absolutely not happening. So it's great to see that physical activity is being brought up in conjunction with the diagnosis of pancreatic cancer. So a diagnosis of pancreatic cancer is difficult enough. Not just from a physical point of view. Sanjay was talking about the enormity of an operation which I had, but it's also really tough mentally. The survival statistics are very low, as we all know, and you know, very little attention is actually paid to that aspect. And you know, I would say that physical activity was actually the last thing on my mind when I was diagnosed. It was never mentioned when I was diagnosed at all. And you know, when I was undergoing my treatment, you know, with the surgery, it took me ages to lift a pan of water for pasta for my kids' tea, let alone you know, go running or anything like that, or even moderate walking. But I gradually did build up my my fitness levels and get back to sort of doing ordinary things like walking the dogs. But, you know, I think at some point, you know, we can't just sort of say, let's prescribe physical activity, because when you're at different stages of different types of treatment, they can impact you significantly. And when I was undergoing chemoradiotherapy, I had the most enormous fatigue problem that I could find it difficult even to climb up the stairs to go to bed, which is there I spent most of my day, especially towards the end of that treatment. So again, exercise was the last thing on my mind. But, you know, getting back to walking the dogs, and that really helped with my mental health, actually, helping me process the enormity of this disease. At that point, I was facing a 3% 5-year survival rate. So, you know, that can really have an enormous impact. And we do know that depression can be a symptom of pancreatic cancer as well. So being able to get out, be active, and also when I'm horse riding, I just find, you know, if you're cantering across the fields and the exhilaration that comes from that, and the endorphins and all of that kind of stuff, then, you know, that really helped with my mental state as well. So it's, I think it's fantastic that we're now seeing studies that are looking at the physical well-being of patients through physical activity, but also that knock-on effect that physical activity has on your mental well-being as well is just as important, I feel.
Mhm.
I would just take it little and often, just do what you can, and don't, you know, I've known patients who have been marathon runners, and before their diagnosis, really super fit people, and they've got extremely frustrated, especially after having a total pancreatectomy, as in one chap who was only 28 and super fit. And he found it really frustrating that he couldn't exercise because it was physically impossible. So this cancer is very different to other cancers in terms of the severity of the disease, but also the severity of the treatments. So it's really, don't beat yourself up. If you know, take it slow, nice and easy, ease yourself in gently and build up gradually, and that's the way to do it. And I think it was Cindy who actually showed that if you actually do a little bit here, then add another bit on, and another bit, you can actually really improve your fitness over a relatively short period of time. So but, you know, give yourself a break. If you're severely fatigued by your treatment, then you don't have to get out and do the walk. You know, you just got to have a balanced approach to it. And you know, thankfully it's not prescriptive at the moment. So but I think patients do need a little bit more guidance in terms of what they can and can't do, because we really don't know.